Have you ever been sick with no time to spare for a doctor's appointment? Even worse, you find out your primary physician has no open appointments until next week. So you are forced to go to the ER only to find out it was no emergency and you now have a $2,000 plus hospital bill. Well, I am happy to tell you that there is a solution to this problem. How many times have you heard that said that internet has changed modern life? Well, it has. And now we have teleclinics. As a nurse and caregiver, not only to my patients, but also to both my parents and my children, I have experienced multiple issues in our healthcare system firsthand. A variety of teleclinics are available to manage your healthcare needs. Are you taking advantage of them? Teleclinics provide on-demand access to healthcare services and providers through digital communication technologies such as computers and mobile devices like your phone. Today, I would like to persuade you to use teleclinics. The use of teleclinics is convenient, cost-effective, and a great solution to accessible healthcare secondary to the nation's shortage of doctors. I will start by telling you how teleclinics make life easier. Using teleclinics is convenient. With teleclinics, a patient can receive convenient healthcare from their comfort of their homes. Teleclinics reduce and minimize the burden and challenges of people with transportation barriers. Oregon's Health and Science University saved patients $6.4 million annually in travel costs by implementing a telemedicine program. Saving patients the time of commuting to their provider's office and sitting in an office waiting is a significant benefit as well, especially with chronic conditions that require multiple appointments a month. Teleclinics make services more readily available for people with disabilities or limited mobility, time, and or transportation. Per a study at a Nebraska Children's Hospital that struggles with frequent no-shows, the implementation of a telehealth program improved no-shows rate by 50%. These clinics also keep hospital beds open for patients who are actually ill and who need to be hospitalized. Next, I will explain how teleclinics can save both patients and providers money. Using teleclinics is cost-effective and efficient. Virtual appointments are significantly cheaper than in-office visits. These services are generally for minor illnesses. Therefore, the clinics can increase efficiency of care and provide services at a lower cost with minimal wait times. Because appointments are for minor illnesses, visits are scheduled with smaller time commitments than in-office visits, allowing doctors to see more patients. And offering virtual visits can also help lower the cost of no-show and late appointment fees. Per the National Academy of Science, Engineering, and Medicine, telehealth can reduce overall cost by reducing unnecessary readmission and avoiding emergency department visits. According to ortholife.com, the average cost of an emergency visit is $1,734. The average cost of an on-site doctor's office visit is $146. A telehealth visit, on the other hand, is only $79 on average. Lastly, I will talk about how teleclinics can improve access to healthcare. Using teleclinics is a solution to accessible healthcare, secondary to the national shortage of doctors. Teleclinics have the potential to improve the quality of healthcare with better patient outcomes. Teleclinics allow patients to quickly and conveniently check in with doctors for guidance, medication questions, and or treatment changes, which can be a critical part in preventing unnecessary hospital admission. Teleclinics also allow healthcare to be more accessible to more people. Teleclinics make healthcare accessible to people who live in rural or isolated communities. One UPMC patient survey showed that 40% of their patients said that if they had not had access to a virtual visit, they would have skipped treatment because of the burden of excessive travel to and from in-office visits. To conclude, it is clear that teleclinics have the potential to positively impact healthcare. Teleclinics are a promising public health tool that will have a positive outcome in our healthcare system. Now that you understand these health clinics, explore your options, take advantage of them. Today, I have discussed why we should begin and continue to use teleclinics, as they are convenient, cost-effective, and the solution to accessible healthcare. Miles Davis once said, "Time isn't the main thing, it's the only thing." Make sure you spend your time wisely. Lastly, I will pass around graphs that were published in 2019 by the American Hospital Association, and they show a clear increase of these telehealth clinics in hospitals. Thank you.